Good morning, good afternoon, and good evening to you, our friends and partners listening in from across the globe. I'm honored to be here with you for 2021 FETP International Nights. My thanks to each of you, FETP residents, resident advisor, and mentors, for taking time to be here today. CDC is grateful, and I am grateful for your dedication and commitment to one of the core sciences of public health, epidemiology. Perhaps you have found this to be both an exciting time and a challenging time to be an epidemiologist. These many months of the COVID-19 pandemic have strained public health systems globally, and still you have been driven to find solutions faster than ever before, working tirelessly to protect everyone around you and to give them more than just a fighting chance. The pandemic has devastated the world's economy, disrupted every aspect of our daily lives, and deeply affected families through the loss of loved ones, all effects that will be felt for generations to come. With your support in conducting disease surveillance and response, and the vaccines that have been deployed worldwide, we are starting to see a light at the end of this difficult, sad tunnel. Evidence-based decisions and policies must be based on solid epidemiologic investigations, rapid and accurate data collection, thoughtful and thorough data analysis, and the dissemination of those data. It is a complicated process, and you have risen to the challenge of meeting those requirements time and time again during the pandemic. Who knows how many lives have been saved and will be saved through your efforts, and for this we owe you a debt of gratitude. In March and April 2020, 65 field epidemiology training programs were surveyed on how they were participating in the pandemic. Even at that early stage of the world's response to COVID-19, 85% of the field epidemiology training programs reported that their trainees were involved in responding to the global health crisis, and 95% reported that their graduates were also working on the pandemic, all involved in activities such as data collection and analysis, contact tracing, and community education and outreach. This high level of involvement demonstrates your commitment and how much your support was needed in the global response to COVID-19. At the same time, many of you were also responding to concurrent health threats. For example, Guinea's FETP graduates and trainees played leading roles in almost every aspect of the response to the 2021 Ebola outbreak, as well as responding to vaccine-derived poliovirus, measles, and yellow fever. Without a well-trained field epidemiology workforce, these outbreaks could have been overwhelming to the country's health system and spread beyond its borders. This is just one example of why the impact and value of FETP cannot be overstated. Complex infectious disease outbreaks like these remind us that more work is needed to strengthen and expand the global field epidemiology workforce through FETP. Support for FETP by host country governments, multilateral organizations, and U.S. government agencies has significantly enhanced global health security by enabling us to work collaboratively and build a global workforce with essential skills in surveillance, data use, and outbreak detection and response. It is wonderful to see that FETP is producing public health leaders who have the training, skills, and experience to manage public health systems and safeguard citizens from potential illness and death from health threats. Not surprisingly, many of our FETP graduates have gone on to become effective public health leaders in their respective countries or in global health organizations. For example, before she graduated from the Pakistan Field Epidemiology and Laboratory Training Program in 2019, Dr. Fatima Munaza, a data usage and risk assessment officer in Pakistan's National Stop Transmission of Polio program, investigated several outbreaks, including measles and extensively drug-resistant typhoid and HIV. On the other side of the world, Dr. Tatiana Lanzieri, the lead epidemiologist for the domestic rubella and cytomegalovirus programs at the National Center for Immunization and Respiratory Diseases, graduated with the first cohort of Brazil's FETP. Her investigation on rubella helped Brazil implement surveillance for congenital rubella syndrome in all of its 27 states. And Dr. Didilnasia Ndiwaziri, a 2008 graduate of the first cohort of the Nigeria Field Epidemiology and Laboratory Training Program, supported the program by leading the epidemiology, surveillance, and contact tracing efforts of the Ebola response in 2014. She continues her service as the national coordinator of the National Stop Transmission of Polio program at the African Field Epidemiology Network Office in Nigeria. Each of you will go on to do great things. That is why CDC is committed to working with WHO and other partners to achieve the vision of the Global Field Epidemiology Roadmap and ensure that countries have the applied epidemiology capacity needed to protect the health of their own populations, collaborate with others, and promote global health. As part of this roadmap, the FETP Enterprise Strategic Leadership Group was established this past April to provide guidance and accountability and drive the development, implementation, and evaluation of FETPs. We see this program as essential for all countries' abilities to achieve international health regulations' core capacities and to ensure global health security. So thank you to our long-standing partner TEFINET and CDC's Center for Global Health for sponsoring International Nights, and to you for the incredible work you do to keep the world safe. Your vigilance and dedication are crucial to help us fight threats like MERS, Ebola, Zika, and COVID-19. Overcoming adversity is always a challenge, but collectively, we can beat these threats. I wish you the very best for a productive meeting and engaging conversations. Keep up the great work.